Hello, everybody, and welcome back to our How To Corner. In today's episode, we're going to discuss ACL tearing, the what, the how, and the why. And I'm Will Gray III, your friendly neighborhood therapist. And before we get started, everybody, please like, share, subscribe, comment, as well as let us know what you think about the content and the material and what things you want us to discuss. And with that being said, let's get going. Now, the agenda for today is that we're going to talk about what is an ACL, how does it work, how do you injure your ACL, and what happens in physical therapy following the injury, as far as you returning from the table all the way back to sport. Now, the ACL is the anterior cruciate ligament, and the way you tear it is in sports most of the time when you're trying to cut, pivot, stop, as well as sometimes just deceleration that occurs. Now, as you see in this image to the right, the ACL is in the front. We can see it facing us, and that image is very simple, but it shows a good representation of an ACL and basically its position and its role and stability in the knee is super important. Now, the anatomy of the knee, as far as the ACL is concerned, is one of the most important ligaments for knee stability. It prevents anterior translation and provides rotational stability. What that basically means is that when you're running, you have to change direction. The ACL is really important for keeping the femur and the tibia together and then allowing the muscles to act around the joint. So it's a static stabilizer. If you didn't have that there when you actually plant and move, your joint would shift and it would cause you to have some instability as well as pain and discomfort. Now, the mechanism of injury, I talked about it in the earlier slide, but I want to dive into it a little bit more. When you have an ACL injury, there's a few things that happen. Usually, you have the injury during a sudden deceleration, pivoting, or awkward landing, or planting, also, as well as cutting. Can also occur from direct contact or trauma, based when somebody dives at your knee and you have it planted. And then trauma in the sense of, you could be in any type of accident or any type of incident on the field, off the field, in your car, stepping off the curb. I've actually had a patient injure their ACL like that. But that mechanism of injury is pretty consistent. It's going to be an injury that's going to occur with some level of deceleration, twisting, rotation of some kind. And as far as the demographic that's more susceptible, you have soccer players that are women. They have a high susceptibility. In recent studies, that has changed some also, but the reason for that is because their Q angle, which means their hips are a lot wider, and then their knee position as it relates to their hips, as far as their anatomy is concerned, just in standing. Now, when you have an injury of the ACL, the one of the biggest things is how do you know, right? How do you know? Most of these ACL injuries are confirmed through MRI or magnetic resonance imaging, and that is the gold standard. And with that being the gold standard, it's important to make sure that when you're getting this imaging done, that you're also aware of the fact that there are some things that cannot be taken from the image until somebody arthroscopically goes into your knee doing the procedure. So you may go in there and you may find a lot more happen, you know, as far as damage is concerned than was first initially thought. And that can explain what occurred as far as relation to the mechanism of injury and where you are from an injury standpoint. So, whenever you're trying to figure out if an MRI would be something that you should do, yes. If you have an ACL injury or scare or something that you feel like needs to be checked out in your knee, using the MRI to be able to diagnose that is great, especially for ACL injuries. Now, let's get to the part that I really enjoy doing, discussing the rehab and return to play. The reason that this is super important is because I think a lot of people probably think it's cookie cutter. I think a lot of people think that physical therapists are all created equal. We're not created equal. A lot of us are very different in how we approach, as well as our ability to be able to do the job. I think that it's in anything you do. You can have a mechanic. Some mechanics are good. Some are bad. Some are exceptional. There's levels. So the biggest thing that we're trying to submit here in your brain is that there's three different things you need to really make sure are occurring early, throughout, and then as you progress. The first thing you want to make sure is happening is the surgery is being protected early on. Just because simple things can happen like falls, trips. People feel like they can come out the brace and not pay attention to some of the precautions. And believe it or not, I've seen it happen. It's very very unfortunate, but it happens all the time. The second thing is that during the rehab portion, reestablishing the range of motion and muscle activation is very 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 important. You have to have that range. If you don't have the range, it doesn't really matter how much strength you have later on if you don't have the range, because the range of the joint allows you to access the full use of the muscle in a sense. Because if I put the muscle in a full stretch, going to be a position where the muscle is being used in its entirety. And if I actually extend your leg and put your muscle in a slack position, just being able to control and stabilize in that full position also. So, which is why a range of motion for bending your knee and straightening your knee are super, super important. Now, when you move from that range of motion and muscle activation to trying to move towards more challenging activities that can facilitate some strengthening and stability, what you have to realize here is that there's a few things as far as touch and go, right? Because there are certain milestones and marks you should use to be able to determine when you're ready and when you're not ready. I think we're in a world of that everything has to be quicker, especially when it comes to sports. The quicker you return, the better the therapist or doctor or surgeon was or whatever. And that's not true. Everybody has a different susceptibility to certain injuries, as well as their ability to be able to recover. Their prognosis is totally different. So, you're just having to base it off of just certain marks, and it's not a time base either. So in the right part of this slide, you see I label things one, two, and three. They're not really to correspond with the left slide. It's just me just trying to elaborate or expand on some of the points I hit in the left side of the slide. So one, range of motion is the most important thing. You want to establish approximately 5 degrees within the range of motion of the opposite leg. What that basically means, if I have 120-degree bend on my right, then I want to have nothing less than 115 on my left. All right. And then quad activation is next, right? You got to get that quad going, activated, contracting, because that quad is super, super important for being able to get that knee or that leg fully extended when you're trying to run. And then the hamstring is just as important on the back side of it to be able to provide that stability for the ACL protection. Now, the next piece of running at 16 weeks, a reason I put that up there, that's kind of like the big milestone. Whenever the athlete gets back to running, that's a massive milestone. And if it can't happen by 16 weeks, there's something going on. That's kind of like the last week of like, okay, we should be running now in a straight line. Maybe not cutting, but we should run in a straight line. And if it can't happen, there's a massive issue. You need to make sure that early on you're doing what you're supposed to do. That's from the client standpoint as well as the therapist standpoint, to be able to make sure you progress to this activity properly. It should not be an activity that when they're trying to do it at 16 weeks, it's a problem. 16 weeks is 4 months for anybody who are not great at math, because I know I'm not great at math. Um, and the last piece, protect the surgery at all costs. All right, sometimes ACL rehab has been pushed too fast and for no reason, honestly. A lot of it is just ego. Um, and sometimes, when we're doing what we need to do, some people are going to go a lot faster, and that's cool. That's dope. Mark that down, kind of figure out what occurred, what were some things that overlapped, as far as one patient to the other, that can kind of sort of help you make a mark on like, hey, this would be something I need to pay attention to when I'm doing the rehab, as well as when you're patient and you're asking the therapist, hey, what are some things I need to make sure I'm able to do to be able to progress, appropriately, whether that's fast, whether that's at a good pace or whatever. And then, like I said, man, use specific markers. I know I've said that a lot just in these past couple of slides, but please use a specific marker. If you don't use a specific marker, you're really opening yourself up to some goals not being hit, and then getting to a ceiling or a place of, plateau where I can't get any improvement. So, and if you don't have a marker, you don't know really what you're going to, because nobody just returns back to the field immediately. There's still steps within that too. Now, I want to say thank you everybody who's made it to this point in the talk. I know these slides and how I do it is kind of, can be boring for a lot of people, but really what we're just trying to do is just share information, educate, help clients, help therapists, help people in PT school to get some understanding of how we do what we do as far as, how we view the recovery from the ACL tear, how it happens. And sometimes, they can be kind of, boring, but at the same time, I'm pretty sure people will take interest in the information that's here. Feel free to slide back and forth, share the information, even, use it if you think it's appropriate. And like I say, like, share, and subscribe. We have a YouTube channel that you're probably on listening to this. So please, hit the notifications, as well as subscribe. We have an Instagram page. We do a lot of shorts. We have a Facebook page. Also, that we share different information on that and content. And we really appreciate everybody who supports us. And with that being said, hope you have a blessed one. I'll catch you in the next one.